Have you ever pondered over the paradox that despite living in an age of unprecedented comfort and convenience, depression prevails as one of the most widespread mental health disorders across the globe? Depression is more than a low mood. It's a severe condition causing prolonged sadness and physical symptoms. What triggers depression? It's multifaceted with different causes for each individual. Biological factors can include genetic vulnerability and physical conditions. Brain chemicals, when imbalanced, might cause depression. Psychological factors include life events or certain personality traits. Mental health disorders like anxiety can co-occur with depression, creating a cycle of illness. Social factors, such as isolation, stress, and socioeconomic status, can also contribute to depression. It's the result of a complex interplay of biological, psychological, and social elements. Understanding depression requires multidimensional thinking and a holistic approach. The more we learn about depression, the better we can support those who are living with it. Depression is a complex mental health disorder that stems from several interlinked factors. At its core, depression is often linked to an imbalance in brain neurotransmitters like serotonin and dopamine, which play critical roles in mood regulation. Psychologically, personality traits and the ability to manage stress can contribute to depression. Early life experiences, particularly traumatic ones, can trigger depressive symptoms. Social factors like isolation, poor relationships, and significant life changes can also lead to depression. Importantly, these elements interact in complex ways, shaping an individual's mental health. In conclusion, depression is a multifactorial condition, with biological, psychological, and social factors all playing significant roles. Understanding and addressing each of these factors is critical in the prevention and treatment of depression. Depression's impact is extensive, manifesting in both emotional and physical consequences. It can create feelings of worthlessness and hopelessness, making everyday tasks challenging. At its peak, it may even trigger suicidal thoughts. Physically, depression disturbs sleep patterns and causes appetite changes, which can lead to weight fluctuations, fatigue, and concentration issues. Depression intensifies other physical health issues too, increasing risks for heart disease, diabetes, and chronic illnesses. While daunting, depression is treatable. Medication, namely antidepressants, can help, while psychotherapy techniques such as cognitive behavioral therapy, CBT, and interpersonal therapy, IPT, prove highly effective. Lifestyle modifications like regular exercise, a balanced proper sleep hygiene, and relaxation techniques can also aid in managing symptoms. It is to be noted that while these methods can significantly help manage symptoms, they are often most effective when used in conjunction with medication and/or psychotherapy. In drawing our conversation towards its conclusion, understand that depression is a complex disorder, a blend of biological, psychological, and social factors. It's not just sadness, but a condition that can disrupt sleep, affect appetite, and change your interest in things once enjoyed. But remember, there's light at the end of this tunnel. With the right treatment and support, individuals can find a way back to normalcy. It's vital to remember that it's okay to seek help, to talk about your feelings. You're not weak for seeking help, but brave. Above all, remember that there's always hope, a beacon in the darkness. Your current struggles are not your future. You are more than your depression, and you have the ability to overcome it. We would like to express our gratitude for spending this time with us today. If this information was helpful, please consider giving us a thumbs up and subscribing to our channel. This not only encourages us, but also helps others in need. Until we meet again, take care of yourself and others. Let empathy guide you. Now, let's hear from some people who've effectively managed their depression. Their journeys underline the resilience of the human spirit and the potency of hope, therapy, and medication. Our first story is about Jane, a 35-year-old mother. She grappled with postpartum depression after her second child was born. Feeling overwhelmed and detached from her newborn, Jane decided to seek help. Her treatment program comprised counseling and medication, supplemented with regular exercise and mindfulness practices. The road to recovery was arduous, but Jane remained steadfast. Today, Jane feels stronger and more equipped for life's challenges. She utilizes her experiences to aid other mothers confronting postpartum depression. Our next story is about Mike, a university student. During his final year, depression gripped Mike due to immense pressure to excel, loneliness, and homesickness. He battled with his academics, lost his appetite, and had difficulty sleeping. Recognizing his need for help, Mike approached his university's mental health services. He underwent cognitive behavioral therapy and medication, joined a support group, and started practicing yoga. Now, Mike is a graduate and in a much healthier mental state. He encourages mental health awareness among students. These narratives emphasize that recovery is possible and you're not alone. Each journey is unique, tied together by the bravery to seek help and the determination to persist with treatment. Remember, it's okay to ask for help. You are stronger than you think, and with the right support, you can overcome your depression.